I see it as my mission, my responsibility to restore the CDC to the gold standard of public health science that it rightfully deserves and owns.
These milestones represent critical progress and show we are on the right track in our fight against the virus. With that, let me turn it over to Dr. Walensky.
Thank you, Jeff, and good morning, everyone. As always, I'd like to start by walking you through the data. Historically, and through COVID, CDC has been criticized for being slow. There's a tension between, do you want to be fast but have to update the data? It may be a little cruder if we do things quickly. Or do you want it all the I's dotted and T's crossed, but it's going to be a little bit slower? And that tension has been with CDC for years. Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing.
Still others are saying, what are you doing, CDC? You're confusing all of us.
The thing that's important, and that is new data that we've seen just in the last several days, but corroborated several times, is that if you are vaccinated and you are one of those rare breakthrough infections, you actually have the capacity to pass it to somebody else.
Cases surge. The CDC cutting the recommended isolation period from 10 days to 5 if you test positive but are asymptomatic.
The U.S. just broke its 7-day average of new coronavirus cases as the new Omicron variant accounts for nearly 60% of cases.
That there should be a negative test requirement at the end of the 5-day isolation period. Why is that not required?
What we do know is about 85 to 90% of viral transmission happens in those first 5 days, which is why one of the main things that I wanted to do is to make sure we were moving things faster. We're in a pandemic. We can't do the hand-wringing. We need to make decisions now. And the absence of a decision is a decision. So we need to use the data that we have in this very moment, as imperfect as it might be, and make a decision based upon it.
Looking back, do you think the decision to advise people who were vaccinated, not to wear masks was premature?
I have spent a lot of time thinking about that question. When I'm left with my own thoughts and I look back at the graphs of what May 13th, 2021 looked like, we had 10 to 20,000 cases a day. We had the Alpha variant. We had published science that demonstrated that the vaccines were working against the Alpha variant. And all of the science in that moment said it was safe to take off your masks. And it was safe to take off your mask if you were vaccinated. We perhaps should have said for now. I do know now, in retrospect, we had masks off for about 6 weeks before the Delta variant really took off here, 6 to 8 weeks. And I think if we had said, despite the science, you have to keep your masks on, that we would have lost trust in people out there.
So when we met in Atlanta, we talked about the balance between what the science calls for and what's practical in the real world. Can you tell me a little bit about your thinking behind that decision on shortening the isolation periods?
We have seen time and time again that the transmissibility of these viruses generally happens mostly in the day or two prior to symptoms and then the 2 to 3 days after symptoms. Our first action was really in the healthcare workers. We would have people who were asymptomatic feeling quite well, and yet we would have ICU beds unstaffed because we did not have enough staff. And so we were really seeing that as a harbinger of what was going to come, not just in healthcare, but in all other essential functions of society. And so we have been wanting and thinking about doing this for a while, and this was really an important moment to do so.
I think we all recognize at this point that COVID-19 is not going away. It will one day be endemic. I'd love to see us as a country be in a place where we're focused a little more on the health and protection of each other as well as our own health. And I think that that would be an incredible gift of 2022.